as to match it to be uniform. We stopped at a brief explanation of what glaucoma is. Please don't be annoyed. It will not stop again. It will not stop again, please.
Okay, sorry. Thank you. Let me just take a brief. I said glaucoma is a group of eye diseases that primarily caused by consistent increase in intraocular pressure, that is pressure in the eyes.
Okay.
This pressure tend to act on the optic nerve that serve vision.
Okay.
Or optic nerve that communicates vision information, visual information to the brain.
Okay.
So when the pressure is much, they tend to act on the optic nerve, and the message or information will be reduced, because of the pressure. The optic nerve is unable to withstand the pressure that is being acted upon it. So thereby it reduces the functionality of the optic nerve.
Okay.
So glaucoma cause, and it's a global health issue because it's a second cause of global blindness, or it is a second cause of leading causes of blindness globally after cataract. So, and vision loss due to glaucoma is irreversible, like I said before. And it doesn't have a definite signs and symptoms.
Wow.
Yeah.
Okay. All right. What can cause this eye problem, glaucoma? What can cause it?
Okay. The major cause of glaucoma is consistent increase in intraocular pressure.
Okay.
When I mean consistent is the pressure keep going. Unknown to the patient, the pressure in the eyes keep rising. They tend to build upon the optic nerve head. Then the optic nerve head start to reduce in size and functionality. That and you know, whatever damage that is done in any part of the nervous system is irreversible, because it cannot regrow. It doesn't have a mechanism to regrow itself. So that causes the glaucoma. So that is the major cause. However, we have different class or type, acute and chronic. I said acute are the ones that usually present with some signs and symptoms such as redness, headache, blurry visions, and otherwise. Chronic are the ones that don't usually present any visual defect. The patient continues until the major damage is done. The patient will now try to run to clinic to find what is causing, why is the person bumping into objects, why is he not seeing far. So these are the different classes of glaucoma. But the major prevalent cause, or the factor predisposing glaucoma, is the consistent rising in intraocular pressure.
Okay, this glaucoma, is it caused by nature or by family, or maybe what the person is watching, or the age we're into now, constant use of telephone, handsets, can those light rays destroy this particular area you're talking about in the eye, or is natural? The constant pressure.
If the glaucoma is hereditary,
okay,
how can one get glaucoma? If I get you right?
Yes, exactly.
Hello?
Yes, that's what I mean.
Yeah, if that is what you ask, glaucoma can be seen in people within the African descent. Okay, yes. So people in the African descent, we call them African American origin or hereditary per se. So glaucoma is hereditary. That is one.
Okay.
When a family has history of glaucoma, there's tendency one or two person in that family will have glaucoma. People of age 40 and above are also predisposed to glaucoma. So when you are 40 years and above, there is need for you to go for comprehensive eye examination to rule out glaucoma. Then when someone has eye injury, if you have eye injury once in your lifetime, maybe a blunt trauma, or there's an accident that happened, and your eyes is swollen up, it affects the ocular structure, ocular system, there is tendency that you may have glaucoma.
Okay.
Then somebody that has a high refractive error is predisposed to glaucoma. People that are having some systemic diseases or conditions like diabetes and hypertension are also predisposed to glaucoma. So these are the factors that predispose ones to glaucoma. So if you look at it, you see where you fall in. You are an African, American, or right now we are in Africa. We are an African, so we are predisposed to it. That is why we, Nigerian Optometric Association, keep advocating yearly or once to go for visual screening, at least once in a year.
Okay.
The tag is check yearly, see clearly.
Okay.
Then if you have a family history of glaucoma, if your dad, your mom, your parents, your sibling, anybody that related to you have such, there's need for you to check your glaucoma status. Then if you have eye trauma, maybe as a boy or a young man, you are going to your friend beat your eyes, close your eyes, or punch your eyes, and it was swollen and red or something. There's need for you to check. After treating that injury, there's need for you to check your eyes, because there might be a lot of pressure built over the years and it can lead to glaucoma.
Wow.
So these are the things.
Thank you very much, doctor. Thank you very much. This problem is terrible these days, and people are not taking care of their eyes. So what are the symptoms of this glaucoma?
Okay, thank you. Like I said at the initial, that there's no definite symptoms of glaucoma.
Okay.
Some other things that we usually see clinically present when a person has headache, redness of the eyes, tearing, even itching. These are some of the ocular signs. But glaucoma itself does not really give one ocular sign. These are maybe one infection or one thing that happens can stimulate the patient with the eye, and when it comes to the hospital or the clinic going on behind the eyes. So there's no definite signs and symptoms of glaucoma, and that is why we call it a theft of sight. It's still your sight without you knowing. If it has signs and symptoms, it could have been even arrested, but because it doesn't have a definite signs and symptoms, it's still your sight. Because someone who has itching, you will just the eye keep itching, you wash your face, clean your hands, wash your face, and that goes off. Or there's redness, it's okay.
Thank you very much, doctor. We wish to thank you very much for the teaching, for your time, for explaining more of this glaucoma problem. And you have said earlier that it is hereditary more of, and everybody need to go for eye checkup at least once in a year.